Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. I'd like to welcome our guest today, Valerie Holbert. She is the owner of Nourish Center, Asheville, where she's bringing mild hyperbaric oxygen therapy and much more to her patients in her practice and the surrounding Asheville area. Valerie is a national board certified health and wellness coach. She's a registered yoga teacher. She's a Reiki master and an HBOT technician. She's in private practice offering all of these services. She believes it's important to nourish our souls and our cells, to find clarity, reconnect to our inner knowing, and implement steps to reach goals. And this is what she does in private practice, helping her clients reach optimal health. So how did you hear about hyperbaric oxygen therapy?
Yeah. So before last summer, like a lot of people, probably the most I knew was that like Michael Jackson used to sleep in one, and maybe some athletes had them, famous people had them, or if you had a wound, they could help. And last summer, my husband suffered a really serious traumatic brain injury. We were in the trauma ICU for 5 or 6 days. And we're kind of released home from there without a lot of support. I was in a hospital in another state, and working in holistic health, I had a friend who specializes in brain health, and she was like, "You've got to get him in a tank." So I started doing some research. We went a few times to Apex Brain Center here locally, who also has 2 tanks, the same model. And then I drove to Atlanta to rent one that we had in our tiny little house for 3 months. And his healing was exponential to what we were told, kind of to expect. And we attribute a lot of that to the hyperbaric chamber.
Excellent. Yeah, I know we've talked in length about this because my husband also suffered a traumatic brain injury from a car wreck. And we're actually excited to get him started on some therapy just to help with lingering symptoms that he has. But I'm so glad to hear that you found this therapy and how it helped your husband so much, because there's so many people that they're just stuck in a certain pattern of, this is it. This is as far as my healing is going to go. Right. And that is not necessarily true. There are other options.
Yeah, absolutely. For brain injury and also concussion, we see a lot of people with, post-concussion syndrome. And you're absolutely right. A lot of times people are sent home without really, knowing about other options like the tank or chiropractic or all, other things that are out there, even nutritional things,
for sure,
that are supportive.
For sure. Yeah. And I know that this is not a new therapy. I was looking over some of the research that you sent me, and I saw that, interestingly, there was a physician around 1928, I think it was around after the Spanish flu, that he built a hotel, like a hyperbaric oxygen hotel, to treat patients that were affected by the Spanish flu, the last pandemic that came. So unfortunately, a lot of his research didn't get published, but it would have been interesting to see that, but that's kind of interesting how that it's been around for a long time.
Yeah. It's been around for a really long time, and that one, the one in Ohio, was like 5 stories high, and and even the very first pressurized room was in the 1600s. That one just blew my mind when I heard it. Like, because I think we probably think of it as being pretty new, but like the idea and the science behind it has been around a long time.
Yeah. So, so what is the difference, between, you said this is a mild hyperbaric oxygen chamber. We know there's higher pressure ones. What's the difference?
Yeah, that's a great question. So the mild tanks go up to a pressure of 1.3 atmospheres or 4 psi. Just for comparison, because probably not everyone knows, what those words mean. But in the higher tanks that we usually see in hospitals or hyperbaric centers, they're going to be using pressures of 1.5 ATA to 2.5 ATA, and going to higher pressures that can equal up to like 33 feet below sea level, again, where this one's more like 11. Those type of tanks are also pressurized with pure oxygen, 100% pressurized canisters of oxygen. So again, while there are some great benefits to that higher pressure and slightly more oxygen, there also are more risks. You can't take devices in. You have to wear just cotton clothing. There's greater risk of fire, and that sort of thing. So the mild tanks, studies are showing lots of benefits still happening, but far fewer contraindications. And you can bring your phone in, obviously, or your laptop, or so it's a little more laid back.
Yeah. User-friendly, right? A little user-friendly.
Yes, yeah.
So would you say that the higher pressure chambers, do they require less time in there, or is the treatment a length about the same?
Yeah, that's a great question, I would say. And that, depends a lot, I would say, on what a person is being treated for and what their physician is recommending. Generally speaking, though, people going to the higher pressure chambers have more serious conditions that might actually, they're probably going for multiple sessions, longer periods of time, 90 minutes for quite a few sessions. Often they're seeing things like diabetic wounds that are non-healing, burns, gangrene. So pretty serious types of conditions, although they're being used more and more for other things too, like, autoimmune conditions and long COVID and that sort of thing.
Yeah. So who can benefit from HBOT?
Yeah, so, the reason that we purchased the tank is because one of the things I realized when I started doing the research, and it's not just like marketing fluff, really, almost everyone can benefit from more oxygen, right? Like, oxygen is what fuels our cells, and more oxygen and healthier cells, healthier mitochondria, reduces inflammation, increases cellular energy. And, working in the health field, that the inflammation is really at the root of so many things. And so when I started exploring and seeing that, I was like, oh yeah, well, that makes total sense. Big picture that, so whether you're looking at as like general health and wellness, I'm going to do this every once in a while, just, as part of my chiropractic and massage and all of those sort of things, or whether you have a condition that you really want to hone in on. We all have cells, we all have mitochondria, and so I would say almost everyone can potentially benefit, yeah.
For sure. Specifically speaking about one of the topics that we're focusing on this month is post-COVID symptoms, or what we call long haul, or lingering COVID symptoms. It seems that there's a lot of people, a lot of my patients in the practice and colleagues, friends that had COVID 6 months, a year ago, and they still do not feel 100%. And I know that there's quite a bit of research out there that shows that this can be a really good resource, a really good therapy, a good way to kind of extinguish those symptoms. And some people may not know, they're listening to this. They may not even realize that what they're feeling right now could be some of these symptoms related to having COVID. But we're talking brain fog, extreme fatigue, dizziness, headaches. I know personally, I had COVID last year, going on about 6 months ago, and I've been having headaches ever since. And I don't get headaches, but I have been now. And it's like a dull, a low-grade headache, but it's just always there, just not feeling, 100%. Persistent cough is another one, tremors, trouble breathing, fever, depression. All of these can be signs that you still have some COVID symptoms, because what I was reading is, of course, we know that when you have COVID, your oxygen saturation level goes low as you're fighting the virus and you're fighting the illness. Right. And that could be days. I know me personally, I was down with it for about 4 weeks. I didn't feel myself. So when your body is in this hypoxic state, that can cause a lot of inflammation and damage to your cells. And this affects each individual differently. So for some people, they may end up with inflammation in their brain, which we call neuroinflammation, and that can cause the headaches. So, and for others, it could be joint pain or muscle aches that they didn't have before. Different depending on the body and what that hypoxic state. So what they're finding is that the HBOT therapy, breathing in the oxygen, getting in that pressurized chamber for, a treatment or several treatments, it's doing several things. It's reversing that hypoxia that you may still have, months and months later. It can reduce the neuroinflammation in your brain, which for me, I did one session with you and haven't had a headache since.
I know. Amazing.
So I know, in fact, that one treatment really helped bring oxygen to my body to help take down that inflammation. But it improves the hyperbaric oxygen treatment can also improve tissue oxygenation, which is ultimately going to help your body heal, as you were saying, from many things. So yeah, and you did forward me, I don't know, at least a half a dozen, maybe more studies that are currently being conducted right now on this topic, and practitioners like yourself who are seeing patients and treating them, and they're finding that within 5 treatments, even some of the people that have really severe post-COVID lingering symptoms, those symptoms are reducing dramatically, or even in some cases completely being eliminated.
Yeah. Honestly, sometimes I'm still amazed when people have these really fast improvements or notice things immediately. People might text me later that night and be like, oh my gosh, I'm feeling this or not feeling this. And it's a different amount of time for each person. Some people might notice something the first time and not. But yeah, in terms of long COVID, it's interesting, Dr. Nicole, when you're listing off all of the symptoms that different people have, some of them sound so similar to autoimmune conditions, which, we are seeing increasing numbers of. And I even read somewhere recently that they were thinking about, creating a new autoimmune condition, for this, long COVID. symptoms. And of course, there's a longer history of studies with autoimmune conditions and HBOT. So yeah, I know it's frustrating for these people. And like you said, sometimes they might not even know, right? Because we've all felt tired or had headaches, and they might not even realize, oh, this is not, the baseline.
Right. Yeah, I mean, so many people are used to feeling terrible all the time that, you know what I mean? That's their their normal,
yeah, true.
And there is a difference between healthy and common, So yeah, it's no surprise. It should be no surprise to us that HBOT is helping people with with these symptoms, knowing that it helps people with autoimmune diseases. And we're finding that COVID symptoms are very similar to autoimmune or causing autoimmune diseases.
Yeah.
Yeah. So,
right. I do think one thing that could be, sorry.
Yeah.
Go ahead. Bit of a lag. I was just going to say that with the long COVID, I'm wondering if one place where HBOT and other, and other interventions like you guys are working on in your office, being able to address them like now, right? Like right as they're coming in and earlier in the game, because oftentimes with autoimmune conditions, it's years and years, and these therapies are still helpful. But I think like for these folks, it's pretty soon after COVID still for most people who've had it that they're experiencing this. So
definitely, I agree. The sooner, the better.
I just wonder if that could be.
Yeah. Yeah. Autoimmune diseases. The symptoms. Once you turn that gene on, it becomes very difficult to quiet down the fires and treat that. It can be done, and it's something you have to work towards and work at. But same with this. And in fact, in our office this month, we're breaking down some of the nutritional protocols that you can take when you have had COVID and you're still dealing with the long haul or lingering symptoms. This I feel, which is why I really wanted to interview you on this topic, spend a little bit of time talking about this specifically when hyperbaric oxygen chamber therapy can be used for so many other things, but specifically, this is real time. This is current. This is what people are. A lot of people. I mean, how many people got COVID over the past couple of years? So this is this is going to be even more of a real problem if we don't get a handle on it now. So, like you said, the sooner we start tackling these symptoms that are still lingering, then perhaps it won't turn into something full blown or a bigger problem later on.
Right.
So we will include some of the links in the show notes.
That's an encouraging piece.
Yeah. And for people that want to see some of those studies and look at them in more detail that you shared with me, we'll include those in the comments section here. We'll also include them in the show notes when we turn this into a podcast. And that way everybody can just, do your own homework and read what awesome things this therapy is doing. So let me ask you, how many sessions?
Yeah, there's a lot of research.
How many sessions would you say a patient can expect to do? Is it different for each condition? How many sessions are needed?
Yeah, it does vary, by person and certainly by condition. We have a little list that comes from we partner with a naturopathic doctor who has 30 years of experience in hyperbarics, and he created a little kind of protocol suggestion. And it breaks down kind of, 1 to 5 sessions would be for things like enhancing performance, pre and post workout, or, newer injuries. 5 to 10 sessions pre and post surgery, sort of more chronic injuries with tissue damage. And by that, I mean, like, could be a sprain, that kind of thing. 10 to 20 sessions and 20 plus. The more chronic the condition really is a good kind of way to look at it too. The more chronic the condition, most likely the increasing number of sessions that are needed. But there's so many different factors, right? Like what other types of things is the person doing? How's their nutrition? And then just all the unknowns. We have a patient in here with chronic Lyme, and he really started, but he's had for almost 10 years, and he started noticing a difference after about 6 sessions. He's going to continue on. But that general kind of protocol from Dr. Ratanzi is helpful.
Got it. Yeah. So would you say that typical sessions are done once a week? How often are they performed? Or does that vary?
Yeah, that varies. That's a really good question. And I would say, for people who are doing it for the general health and wellness, they could do it once a week or even once every couple of weeks if they're integrating it into these other things they're already doing. Like we mentioned, the chiropractic, massage, acupuncture. For people, if you're working for a specific condition, like long COVID or Lyme or postconcussion, most of the studies that have been done are done with clustering sessions. So doing 3 to 5 sessions in a week, taking a couple of days off, and then, following up with that. Or for surgery, do 3 before or 3 after. So studies seem to support that clustering effect and the build effect from it.
Okay, got it. Yeah, I definitely see the benefit just with the one session that I did. I'm already excited to set up another appointment just to, I felt increased energy. I can see once a month, for it being part of my natural healthcare plan, just to keep me healthy and give me more energy, help clarity. I just don't have time to have fogginess going on. And I felt really clear, lots of clarity.
Yeah.
And I like that, that's important to me, should be important to everybody. But yes, I definitely see the importance of it.
Yeah, that's so great.
So I've heard people say, especially since I've met you.
Yeah, that's so great that you had that experience.
Yes. I've heard people say, well, what's the difference between hyperbaric oxygen therapy, getting in the chamber, in the vessel that you're in now, and going to an oxygen bar? Why don't I just go to an oxygen bar? So what's the difference there?
Right. Yeah, that's a great question. I hear that often as well. So, you could go to an oxygen bar and you would get benefits, or you could, sit in the office here and just be hooked up to the supplemental oxygen. And if you were doing that, yes, you'd be breathing in more oxygen than ambient air. But the added benefit from the tank, and why you get benefits even if you don't have supplemental oxygen, like right now, I don't have the cannula in, but I'm still getting benefits from the pressure. There's a couple different laws of physics, and hopefully I'll get them right here. So Boyle's law of physics says that under pressure, molecules become smaller. Henry's law of physics says that under pressure, a gas can move into fluid. So with those two things in mind, what's happening and why the tank is different from the just breathing in additional oxygen is the pressure. So that pressure is making the molecules smaller, and so therefore they're moving more readily into the cells, into red blood cells. And not only that, they're moving into plasma, they're moving into spinal and cerebral fluid, lymphatic fluid, where usually oxygen is not able to go as readily. So that's why the pressure, and why these folks, from 1600s to early 1900s, were experimenting with that. And one of the guys, he actually kind of came to that conclusion because he noticed, and you kind of touched on this, but he noticed that in his area, the people who lived in the valleys were recovering more quickly from the flu, from influenza, than the people who lived in the mountains and the higher altitudes. So he had this theory of just wondering, thinking that the pressure was a piece of that.
Okay, yeah. Well,
so the pressure is the answer.
Yeah. Okay. I think you explained that really well. So you know your physics. Would you mind?
Yeah, I'm more of a big picture person, but
Yeah. I think it'd be really neat if you could. Now, I've been inside the vessel in the chamber that you're in now, and my session. I can't explain how comfortable you made me. It was really. I'm stressed about things like this, and you're just soothing. You have a calm way about you, but basically, it inflates, and so there's a zipper, and you lay down, and that's what you're doing right now. I think it'd be a really great idea. Would you mind showing everybody the inside of it?
Yeah. I think I can do that. So, usually my teenage daughter's my tech support, so, but I think I can turn it around. So,
okay.
Yeah. Okay. Yeah. Okay. So great. So you can see there's my feet down at the end there. And I'm about 5'5", 5'5.5". The tank is a little over 7 feet long. So like my husband's a big guy. He's 6'2", a big dude, and he fits comfortably in here. And you mentioned the zippers, Dr. Nicole. So the zippers along the side here are what seal the tank, so that it can stay pressurized. There's a little gauge on the inside. My head is at the top here, and there's a window into the office. Sometimes folks are concerned beforehand. There's another window down there. And these ribs kind of hold, help it hold its shape when it's not inflated. But there are a lot of folks that have concerns, before they come in. And I can sit up in here like it's not. Again, if you were much taller than me, like sitting up, you might prefer to lay down. But you can move around and you can, stretch and that sort of thing. And so far, everyone that we've had that has concerns, about it being too small, or, a lot of us are a little claustrophobic. I am too. But so far, everyone has found that once it inflates, it really feels roomy. And technically, this is their 2-person model. And we've had quite a few mothers and daughters, fathers and sons, even a couple, come in at the same time. But most people like to just enjoy the extra space for themselves.
Yeah. And I do love how you can bring in your devices, which I didn't. And I think next time I will, because that made me a little, I needed something to distract me. It's just the way I felt. But even a book or music or just something. I did a lot of deep breathing. But I love how you have the walkie-talkie so that, at one point I didn't even have my watch on, and I was like getting a little nervous. I'm like, how much longer do we have? And we could talk via the walkie-talkies, which was really nice. And you do a really good job of making everybody feel comfortable, for sure.
Thank you. Well, I think that's so important because, we don't want anyone to be in here making their cells healthier and, working on that and not have a regulated nervous system, right? Like, so I really want people to feel comfortable, to know, like you said, we have the walkie-talkie, people have their phone. I can hear people outside of the tank. There's just, the hissing sound that you can probably hear, and I just think it's really important to be comfortable,
Yeah, for sure. For sure.
And we didn't touch on this before, but your body will go into that parasympathetic nervous state also usually at some point during the session, just from the additional oxygen, and that can carry over even once you've left the tank.
Yeah, I felt that for sure after my treatment, which, for the people listening that do not know what that is, it's your relaxation state. Your nervous system is calmed down, and it really feels good when you come out of the tank. So are there any contraindications, any reasons why somebody should not consider doing this treatment?
Reasons why somebody could not do it?
Contraindications, why they shouldn't get inside of there and have a treatment.
Yeah. Sorry, there's just had a little bit of a lag.
Yeah.
Yeah, great question. The only true contraindication is collapsed lung or fluid in the lungs. However, so there are 14 conditions that the FDA approves the tank for, and those are, some of the ones we touched on before, usually folks in the higher tanks. We do require a prescription referral from a state licensed practitioner. So, for instance, you can refer your patients, but we have partnered with a naturopathic doctor to provide a free safety screening to our patients that acts as that prescription referral, so that we can be sure that, everyone that comes in the tank, that it's safe for them to do so. It's not a contraindication, but the tank can lower blood pressure. So, we want to know if somebody's on blood pressure medication. We want to be aware of that. It can also lower blood sugar, which can actually be, a great result. But again, if someone's diabetic, we want to make sure, or they have low blood sugar, we want to make sure they've eaten before they get in. So that safety screening is just designed to make extra sure that, that we know, again, that's going to be a good experience for the person getting in. And it's always great if, if someone, the HMOT doesn't treat conditions. It can be used in support of, general health and wellness for lots of different things. But we love it when people's other providers are on board, right? So, like, for instance, the client I have with chronic Lyme disease, his acupuncturist and his functional medicine doctor are on board and aware. And, we love being kind of part of that integrated team also.
Yeah, I love that you do that. It makes me feel more comfortable about referring my patients to you. So that's great that you're doing that. You're taking those steps, those precautions, because...
Right. Yeah, we don't want to just pop anybody in here and,
Yeah. So Back in Balance, if you're a patient of Back in Balance, we have partnered with Valerie at Nourish Center, Asheville, to give you a first treatment and a discount on your first treatment, about half off, I do believe. So ask us for that coupon code so that you can go have your first treatment and try it out. I highly recommend it. How can people find you? How can they make an appointment with you, even if they're not patients of ours? How can people find you? Where are you located?
Yeah, so if you are a patient of Back in Balance, you know where they're located on Hendersonville Road, and we're just 2 doors down from them at 1095 Hendersonville Road, and Suites D and E. And online, it's nourishcenterasheville.com. You can book from there, and on there you also will see our phone number and email, and folks can always text me. If you're not finding the appointment time that you're looking for, or if you just have questions, I'm also happy to just do a little consult, and we can talk about what someone is, what they're working through, what their goals are. Done that for quite a few people. We can chat, and if you decide it's for you, then great, and if not, that's okay too.
Perfect. Well, I strongly encourage everybody to try it at least once, see how it makes you feel, see how it makes you heal. I love that. I love what you say, Valerie, that it's important to nourish our souls and our cells, to find clarity, reconnect to our inner knowing, and implement steps to reach goals. I know that's your mission. That's what you're doing in your office and your practice. I love it. I definitely resonate with that. It's speaking my language, and it should for all of us. So thank you for...
Yeah, you guys are,
Thank you for taking time out today.
Yeah, well, thank you for having me here.
Yeah. Excellent. Well, thank you all for watching us today and joining us on this Facebook Live and podcast. We'll email this out as well. If you need that code, if you're a patient of ours, to set up that appointment and get your half-off discount, let us know. We'll be happy to give it to you. Hope you all have a wonderful day and enjoy the rest of your treatment, Valerie.